Angie, you've done quite a few on-site visits with health systems lately. I'm curious to see if there was any trends you noticed in regard to admin staff.
Yeah, it's 2025, and I'm still so shocked with how much time admin staff can spend just on incoming faxes.
Yikes, facts in 2025. Can you unpack that a little bit? What does that mean?
Yeah, so staff can spend hours each day printing, scanning, sorting, and routing. It's a very manual process, often with multiple handoffs, signatures, and rescans. And someone that doesn't live and breathe this every single day, looking in from the outside, you're like, why are we doing this? But a big reason is just because of interoperability and data sharing across EHRs. It's not where it quite needs to be, so fax ends up being the best and fastest channel for information to get from one clinic to the other.
So I imagine spending all that time manually processing faxes takes away from all of their other work that they need to do, but it probably also has downstream implications for patient care.
Yeah, so whether they have a dedicated full-time employee just monitoring faxes or whether it's a catch-all basket for when people have time, every referral, prior auth, RX refill that comes through demands some individual attention, whether that's just processing, sorting, and getting it to the right place. This leads to delays, patients getting frustrated. We'll hear jokes all the time of pharmacies sending the fax again if you don't respond within 24 hours. And so at the same time, these are really critical for success of the organization and happy patients.
So how do we approach solving for that?
I think it's really powerful with FaxTransform, Luma's fax automation tool, is that we're not just ingesting faxes. We aren't just scanning and categorizing. It transforms this PDF into a structured, actionable task that directly maps back into the EHR and patient access systems.
So that sounds like there's a lot going on behind the scenes there. Can you show me how we can actually get faxes out of a work queue into actionable tasks?
Yes, totally. This is our main fax dashboard. Whether we're fully automating this or we're doing the human in the loop manual approach, the actual actions and automations that are happening remain the same. So here, I'll pull this open, I'll hit review fax, and you can see on the top right, we've already matched the patient. You don't have to search for a patient, identify who they are, squint really small to look into the PDF. We did that work for you. We've already categorized this document as a prescription refill. Super easy. This means that this pharmacy will no longer send you more faxes because they know that you've received this. We have the date on the document. This can differ if it's a lab or order. It might be the date the order was taken. It might be the date the results came up. It might be the encounter date itself. All of these minor things may seem small from looking in, but someone working on this every single day, going through hundreds at a time, every little step makes that process easier. Down below, we'll see here all the workflows that will kick off. Once I hit submit fax, all those downstream workflows of routing to the provider, getting a message sent, somebody getting this into the patient's chart into the right place, all of that is taken over by just hitting submit fax. And again, this can be completely automated or have this human in the loop approach where you hit submit.
Interesting. So this looks really cool. It sounds great, but is it out in the wild yet? Are people actually using it and getting results?
Yes, DENT was one of our first go-lives with FaxTransform. They've reduced their processing time from 5 to 10 minutes per fax down to 10 to 50 seconds per fax. Prior authorizations and refills were their biggest use case, and now more than 50% of those are entirely automated, and so no one needs to touch them at all.
Wow, that's really incredible. If you're interested in learning more about FaxTransform, please click the link and learn how we can help.